Hello! Today we're going to have an introduction to anatomy and physiology. And it's important because, as everybody knows, it is the foundation of nursing and medicine. First of all, let's define the word anatomy. Anatomy is nothing else but the study of human body structures. As you can see here in this model here, the human body is made up of different structural parts. For example, you have here the liver, stomach, you have there the heart, the lungs, small and the large intestine. So these are important structures of the human body. Now, what about physiology on the other hand? Physiology is nothing else but the study of function. For example, in the case of the human heart, we know that the human heart is found inside the chest. And what exactly does it do? What's the function of the human heart? The heart is a muscular pump. What does it pump? It pumps the blood. And what does the blood contain? It contains oxygen, which is now transported by the red blood cells found within the blood. Now, why do we need to make the red blood cells carry oxygen? Because every single cell in the body needs oxygen. So that is what we mean by the function of the heart, to pump blood. Okay? Now, the most important thing now is to define and use medical terminology. Whether we like it or not, we have to study medical terms. For example, if we say anterior, what does anterior mean? Anterior means front. Front. What about posterior? Posterior means what? At the back. At the back. Okay? What about superior? Superior means on top. What about inferior? Inferior means below. Okay? What about if we say proximal? Proximal, it essentially means that it's near the central part of the body. On the other hand, as a distal part, is further away from the central portion of the human body. Okay? Now, at the same time, it's important to know other terms that are commonly used. For example, the word cephalic. What does cephalic mean? It means head first, or head. Example, when the baby is born, and when the baby comes out through the birth canal, and when the baby's head comes out first, it means what? Cephalic presentation. When the baby is born, it is coming through a cephalic presentation. Now, what are the words that we need to know? For example, the word axilla. Axilla is a term which means armpit. What about the word brachial? Brachial means what? Arm. Okay? What about carpal? Carpal means wrist or hand. Okay? What about when you say thoracic? It refers to the chest because it's called the thoracic area of the body. Okay? Abdominal area is this area here. Okay? So again, it's very important to know the medical terminology. It's very important because if you do not know the terms and the definition of these terms, then you'll have a hard time understanding the concepts in anatomy and physiology. Now, before we proceed, let us define the word anatomical position. What exactly do we mean by anatomical position? Anatomical position is when the model, or the anatomical model, stands erect with the arms on the side, with the palm facing forward. So the palm has to face forward like this. Okay? And that means your arms are on the side with the feet together. This is called the anatomical position. Now, it's also important in anatomy that we need to review the planes, or what we call the anatomical planes. What exactly are these planes that we are referring to? These planes are essentially imaginary planes that you find in the body. Okay? Now, let's see. First one would be the what we call the transverse plane. So when you say transverse plane, it means dividing the body into what? Upper and lower portion, superior or inferior portion. Okay? It could be here, upper, lower, this. In the neck area, upper and lower portion, or here, upper and lower portion, or otherwise known as superior and inferior portion. So that's called the transverse plane. Again, as I emphasized a while ago, it's an imaginary plane. Another name for transverse plane is horizontal plane. Now, on the other hand, when you say sagittal plane, the sagittal plane essentially passes to front and back, which means it divides the body into a left and a right. Now, if this plane or imaginary line passes through the midline, then it's called mid-sagittal plane. Now, is it possible for it to be found here on the side? Yes, it's called a parasagittal plane. A parasagittal plane, therefore, divides the body into a left and right, but it's not in the midline. It could be found on the left, it could be found on the right. It's called the right or left parasagittal plane. Okay? Now, what about the third plane? It's called the coronal plane, or otherwise known as the frontal plane. What does it do? The frontal plane divides the body into two, anterior and posterior portions. So what does the frontal or coronal plane do? It divides the body into a front or a back. Frontal or coronal plane, anterior or posterior portion. Okay? So again, as you can clearly see here, we need to know the planes. And it's very, very important. Now, the next thing we need to know also would be the different cavities in the human body. Okay, what are these cavities? You can define them as basically made up of two components. One, in front, whatever cavities they have, cavities are not basically spaces. The cavity in front is part of what we call the ventral cavity. Ventral means here. What about at the back? Dorsal cavity here. Okay, at the back, dorsal, and in front is called ventral cavity. Now, observe that the ventral cavity, in fact, is made up of smaller cavities. One of them is the one you find here. If I remove the chest plate made up of the breastbone called the sternum and the rib cage, you expose the thoracic cavity. Bear in mind, the thoracic cavity contains the structures inside, such as the lungs, the heart we removed a while ago. That's made up of the organs found within the thoracic cavity. Now what about here? It's called the abdominal cavity. Notice here in the abdominal cavity you have what? The liver, stomach, small and large intestines. So these are organs found in the abdominal cavity. What about the pelvic cavity? Well, here you'd expect to find the urinary bladder. Okay, in the case of women, you have your what? Your uterus. So if I were the uterus, you have the fallopian tubes, see? And the ovaries. It's found in the pelvic cavity. Okay? Now, it's important therefore to know the dorsal cavity too. At the back here, there are two components of the dorsal cavity. What are these? There are only two. One of them would be the cranial cavity. And in the cranial cavity here, as you can clearly see, you would expect to find what? The human brain, see? So the human brain is inside the cranial cavity, see? This is the one called the human brain. So apparently, if you look closely here, the cerebrum, or the brain, which is exemplified by this particular model here, is found inside your cranial cavity, which is found inside the skull, of course, right? Okay? Now, the other cavity that we are referring to would be the spinal cavity. The spinal cavity, as you know, is basically where you find the spinal cord. If the brain is found inside the cranial cavity, then the spinal cord is found within the spinal cavity. So these two, cranial and spinal cavity, make up your dorsal cavity. It's where you find the cranial and spinal cavity in the dorsal cavities, while the ventral cavities include the thoracic, which is where you have the heart and the lungs, the abdominal cavity, where you have the small, the large intestines, like this one, and of course, liver and the stomach, okay? At the same time, you also have your pelvic cavity, which is, of course, as you can see here, that's your uterus, your fallopian tubes, and the ovaries, okay? So that's what we call the pelvic cavity, and of course, in front here would be the urinary bladder, okay? So it's very important that any doctor or future nurse must know these structures or organs. For example, if a patient comes to the emergency room like this, obviously he does not have a headache. When somebody clutches his chest, then obviously he has chest pain. And so we know already what is found in the thoracic cavity or the chest cavity would be what? The heart, right? And as you can see, the heart is therefore one of the primary considerations you make when a patient comes in clutching his chest, and probably you are dealing here with what we call a heart attack, or in medical terminology we call that myocardial infarct. Myocardial means the muscles of the heart, infarct means they're dead or dying because of the lack of blood flow. Why? Because as you can see here, the heart muscles has blood flow in the form of arteries which carries oxygenated blood. Okay? So the idea here therefore is, one has to master anatomy, which is the structure, and physiology, which is the function, because if you know what is normal, then you know what is abnormal. A patient, for example, with hyperacidity and stomach ulcers, where would you expect the pain to be? Here, in the epigastric area, which is found here. Okay? Because exactly that's where the stomach is supposed to be found, right? Okay? Again, the idea here is that when you look at these organs here, we need to know where they are found, because by knowing where they are found, then as a clinician, whether you're a doctor or a nurse or any form of healthcare professional, you will know what the problem is. Okay? So this is very important to know the anatomical structures and their corresponding functions. Okay? So again, it's very important therefore that we talked about the importance of these things. Now, in the structural organization of the human body, you and I, and any human being for that purpose, we know that we're in the Homo sapiens, we're all Homo sapiens, right? We're all the same. Why? Because apparently we're all made up of what we call chemicals, right? So when you're dealing with the human body, whether we like it or not, you and I are the same because we are made up of chemicals. Do you know that 66% of your body weight is made up of water? Now, where's the water found? Inside the cell or outside the cell? Now, who needs the water? Obviously, the cell. So most of this water, therefore, is found where? Inside the cell, right? Okay? So apparently, chemicals such as H2O, which happens to be the 2 atoms of hydrogen and 1 atom of oxygen, forms water, which is 66% of your body weight. So can you imagine if you're 100 pounds, then 66 pounds of that body is made of water. And why do we need to know that? For example, a patient with suffering from diarrhea. Obviously, when you have diarrhea, you lose a lot of water in your stool. So let's say you lose 2 liters of water in that stool. Will that significantly affect your weight? Yes. So when we are observing or monitoring patients in the hospital, we monitor the urinary output, at the same time the weight of the patient. Because apparently when you look at the weight and the vital signs, it will definitely significantly affect your vital signs, such as your blood pressure and your heart rate. Okay? Because we know that water is part of your blood, right? So again, that's very important. So when a person has diarrhea, you lose a lot of water in your stool. So is water important? Very important. That's why when you hear the word water is life, that is true. Okay? Because you can become dehydrated if you lose too much water in your body. It's called fluid deficit, from the word water, fluid deficit. Okay? Now, what other chemicals are found in the body? Well, we have calcium. Okay? Calcium is important, as you know. Why? Because, as you can see here, our bone, our skull, our different bones of the body, what do they contain? Calcium. Okay? So, do we need calcium? Yes, we do. What about the muscles? The muscles that we have. These muscles that are important for movement of the joints, do they need calcium when they contract? Yes, they do. Okay? So very important. What about the thyroid gland that is found here in front of the neck? See? It needs iodine. So these are some other elements that are needed. Iodine, natural source would be what? Seafood, the fish, okay, crabs. So that's a natural source of iodine. Now, that's important. So these are important chemicals that we need. Okay? So from carbon, from hydrogen, oxygen, iodine, of course, they're very important. Iron is important, right? Because that is important, that is found in the red blood cell. That's why if you happen to have what we call iron deficiency anemia, anemia means a decrease in your red blood cell count and hemoglobin levels, then if the most common form of anemia would be iron deficiency, and what do we give our patients? we give ferrous sulfate, which is exactly a form of iron supplements, to people who are suffering from anemia due to iron deficiency. Now, this is very commonly seen among pregnant women. Okay? So it's very important. Now, so as we have said, we are made up of what? Cells. Okay? But these cells, as we know, are made up of chemicals too, right? So from chemicals, you have cells, and then what happens? After cells, what do you have? Tissues. So what's a group of cells? They're tissues, okay? And what happens when these tissues group together? You form what we call organs, okay? Now, once organs group together, examples of organs would be what? The heart, the stomach, liver, gallbladder, urinary bladder, the brain, okay? When organs group together with the same function, they are now called a system or organ system, right? Example would be the skeletal system, your bones, the muscular system, your muscles, okay? What else? Your nervous system, your brain. Your brain and your spinal cord are parts of what we call the nervous system, okay? What about the digestive system? Of course, your small and large intestines together with your stomach are part of the digestive system, okay? Urinary system, of course, involves the kidney, see? So here are the kidneys in this particular specimen here. They're found on both sides at the back. And the ureter and the bladder, these are part of the urinary system, okay? And of course, the reproductive system, okay? For example, the uterus. At the same time, your fallopian tubes, see? If I were the uterus, fallopian tubes, the ovaries. At the same time, you also have your, in the case of the man, you have your what? The testes, which is the male gonad. The female gonad is the ovary, okay? So this system we'll be studying this in the next series of lectures, okay? Now, of course, when the organ systems group together, you have your body as a whole. Okay? So again, the important thing here to remember is that we're all the same. We're made of chemicals. When chemicals group together, they form cells. And when these cells group together, they form tissues. And when these tissues group together, you form what? Organs. And organs group together, you form organ systems. Right? And then when these organ systems interact, and you end up with the entire body as a whole. Okay? Now, we will have special lectures on different parts of the human body, like for example the cell. We're made of billions of cells, and what's very important, okay? We'll be showing you in the future some slides. At the same time, we'll be able to have a movie on the different parts of the cell. Bear in mind that the cell is protected by what we call the cell membrane, right? So if this were the cell, is there a cell membrane that protects the cell? Inside the cell, you have the different organelles found within the cytoplasm. One of that will be your mitochondria. The mitochondria is part of the cell that is important for the production of energy, or what we call ATP or adenosine triphosphate. Another component of the cell is your Golgi body, okay? And that's important because it's important for storage of certain secretions by the cell, okay? So again, but the most important controlling center of the cell would be what we call the nucleus, okay? So we're going to be showing a movie on that later on the cell. And inside the cell there is a structure called the nucleus, which contains the chromosomes, which eventually ends up containing the genetic code of the genes, right? So that's why the nucleus is the controlling center of the cell. And then of course there are what we call ribosomes. Why are ribosomes important? Because they're important for protein synthesis. And they are attached to what we call the endoplasmic reticulum, which basically therefore makes it important for protein synthesis if this endoplasmic reticulum contains ribosomes. So if the endoplasmic reticulum contains ribosome, we call it rough endoplasmic reticulum. If they do not contain ribosome, then we call that smooth endoplasmic reticulum. Important for lipid synthesis and storage, and therefore, unlike ribosomes for protein synthesis, in the rough endoplasmic reticulum, the smooth is important for cholesterol and lipid synthesis. Okay? So again, they're important structures. We're going to be discussing this in detail as we move along. Okay? And this is just an introduction to anatomy. Okay? Now, what about tissues? for tissues, essentially, there are four. There are four types. The first one is what we call epithelial. Epithelial, okay? So when we're dealing with epithelial tissues, bear in mind that these are protective tissues, okay? So let me write this down. So epithelial is number one type of tissue. Epithelial, exemplified by your skin, protective layer of the body, protection against infection by germs. Okay. The second one will be connective tissue. Okay, so these are types of tissues. And the third one is, of course, your muscle. Now, I failed to mention in connective tissue would be your tendons. Like this one here. See, tendon attaches muscle to bone. It's an example of a connective tissue. It links organs to other parts of the body. The bone is an example of a connective tissue, which is called heart. What about the blood? Is actually an example of a liquid type of connective tissue. Okay? Now, muscles, essentially there are three types of muscular tissue. First, you have your what? Skeletal. So skeletal are obviously the muscles found in your attached to your bones, and these muscles are important for movement. Skeletal muscles are voluntary, they're controlled by the brain. So if I want to contract and bend my wrist or elbow, I need the muscles here. Okay? And there's going to be a lecture series on these on muscular system. Okay? Now, what about your second type called cardiac? Obviously, the word cardiac means heart. So it is the muscle that you find where? In the layers of the heart. So when you say myocardium, for example here, if I were to open this heart, you will see that this is called the myocardium. Right? So myo means muscle, cardio means heart. Okay? So that's an example of the second type called cardiac muscle. Now, what's the third one? Smooth muscle. Now, in the smooth muscle, essentially these are found within the hollow organs of the abdominal cavity, like the stomach, right? So essentially, these are found within the hollow organs, including what? Your small and large intestines, like this one here, see? So if you notice, inside the walls of the small and large intestine are what we call smooth muscles. So again, there will be an important lecture series on the muscular system, okay? Now, again, it's important to know that the fourth one is considered the neural tissue, okay? So essentially, what do we mean by neural? Talk about nerves. So these are the tissues you find where? In your brain, in your spinal cord, okay? The brain and spinal cord. So essentially, what happens here is that you have to know that these are important structures within the human body, okay? And especially the brain and spinal cord. We are what we are because of our brain, our memory, the capacity to learn, see? So there's a reason why our brain is made up of billions of neurons. Now, what are neurons exactly? N-E-U-R-O-N. A neuron is a nerve cell, okay? It has the capacity to transmit nerve or what we call electrical impulses, okay? We also have peripheral nerves. So if somebody will pinch me, I'm able to feel the pain because it travels through what we call sensory nerve. Sensory means sensation, feeling of what? Pain. Travels all the way from the spinal nerve, spinal cord, then all the way to the brain, and we can perceive the pain. That's how important your neural tissues would be, okay? So again, it's very important that we need to know the different types of tissues. At the same time, we need to know about the different types of organs and organ systems, right? So again, so there are many types of, in the organ systems, as I've said, the first one would be the integument. What is the integument? Your skin, okay? So apparently when you're dealing with the skin, you're dealing with what we call the integumentary system. Now, what exactly do we mean by integumentary system? It's the skin plus the appendages of the skin, just as your hair, okay? What else? The sweat gland, which is otherwise known as your sudoriferous gland, you know. At the same time, your sebaceous gland. Sebaceous means sebum, sebum means oil. Oil glands in the skin, okay? And the hair is considered part of that. At the same time, your other organs, okay? So these are part of the integumentary system. So don't worry, we're going to go over all these systems. Now let's just give an overview of the systems because we're going to cover this in the next lecture series. Another important system is your skeletal, right? Your skeletal system. So as you can see here, you have your bony ribs. Your sternum in the middle is an example of your rib, okay? Again, we also have, like this one here. Example here would be this, the bones of the leg, the tibia and the fibula, and the bones of the foot, and the arms and the forearm. So the skeletal system, they're important because they provide the necessary framework, the support. Can you imagine without any bone in your body, right? Okay. Another system that we're going to go over next would be on the muscular system, the muscle that you have, right? Which we already covered briefly. So this is a special topic on the muscular system. We talk about skeletal, cardiac, and smooth muscles. Okay. Now, what about the nervous system? Yes, brain and spinal cord. We're going to talk about that, and the peripheral nerves and autonomic nerves. Okay. Now, what else? Now we have to talk about the endocrine system. Endocrine means a gland that has no ducts, therefore allowing the secretion of hormones directly into the blood circulation. Okay. Unlike your sweat gland, which is ducts. If this were the surface of the skin, the duct is here, the gland is there, the sweat comes out to the duct, D-U-C-T. On the other hand, endocrine glands do not have ducts. So the endocrine system made up of endocrine glands like your pancreas, right? Your thyroid gland over here, see, the thyroid gland is an example of an endocrine gland. Okay? So what about your pancreas? See, the pancreas is another example of an endocrine gland that secretes your insulin, which is designed to lower your blood sugar. So if you lack insulin, what happens to your blood sugar levels? It rises. It's seen in diabetic patients. Okay? So an example of endocrine. Now, what about respiratory system? Of course, we're dealing here with what? The lungs, right? Here are the lungs here. See? The lungs are important for the exchange of oxygen and carbon dioxide. We produce waste called carbon dioxide. What do we do with that? We exhale carbon dioxide. This carbon dioxide is produced by the cells. Every single cell in your body produces carbon dioxide as waste. We need to get rid of them by exhaling them. On the other hand, we inhale what? The air containing oxygen because the cell requires or needs oxygen to survive. Without oxygen, the cell will die and we will die too. See? That's why we need the respiratory system. Now, what about the cardiovascular system? Of course, obviously it includes what? The heart, right? So again, if you notice, the heart, as I already mentioned, is a muscular pump. It pumps the blood throughout the body because of the various blood vessels we have. If it's red, it's an artery. If it's blue, it is a vein. So it carries mostly carbon dioxide. It is a vein. The blood carries mostly carbon dioxide. While if it's red, it's an artery. It means the blood carries mostly what? Oxygenated blood. Okay? So it's like a freeway, which allows the flow, you know, like a 405 freeway, whatever freeways you have in your place, which allows the transport of nutrients. What else? Oxygen and carbon dioxide. Okay, that's your cardiovascular system, including the heart and the various blood vessels in the body. And we're going to talk about also the lymph nodes. Okay, spleen and other organs part of the lymphatic system. And hematologic system is essentially talking about what? The blood and different components of blood. Okay, and of course, as I said, we're going to talk about the urinary system too. We're going to deal with the kidneys. There you are, kidneys, ureter and bladder, and how is waste released in the urine that's formed by the kidney. Okay, and most importantly, reproductive system. As I've said, if this is the uterus, fallopian tube. Most importantly, the female gonad called what? The ovaries. Female gonad. What about the male gonad, which is the sex gland, which is the testes in men, which produces the sperm. And therefore, that's why they're very important organs. Okay? So we will end there today. It's just a matter of just giving you a brief introduction to anatomy and how important it is as a foundation for nursing and medicine. Okay? Without anatomy, then you will not be able to effectively become a safe, competent medical practitioner or a nurse practitioner or whatever healthcare you are in. Okay? We need to study anatomy. As I said, it's a study of body structure, while physiology is a study of body function. It is incumbent and imperative that we need to know the different structures of the body and their normal function, because if you know what is normal, anatomy and normal physiology, then when you go to the higher levels of understanding, especially what we call pathophysiology, then you know what is abnormal. and that's very important. Okay, so we'll end there, and then we will soon have the other lectures on the other organ systems. Thank you. Bye-bye.